Hi, everyone. I am Ivalee Sanzino, founder of Radical Health. We're going to go through a few pieces, of housekeeping to kickstart this meeting. First, what we're going to do is everyone is on mute. Obviously, if you can unmute yourself at any time, but we'll have some section for Q&A at the end, so you can ask questions there, and I'll unmute the line so we can do that. Another important piece of information is that this information session is being recorded. So I figured you all should know that. We will record it and share it once this is done, for those who weren't able to make it, or for yourself if you wanted to hear it again and have that information. Another piece of information in housekeeping is that there is a chat box on the right-hand side. So feel free, if at any time you have a question or need me to repeat anything, or if I'm breaking up and I'm not clear, please use the chat box. And I just sent you all a message, so if you can give me a thumbs up or a check mark or a hello to let me know that you're all on there, that would be great. Okay. So again, just the chat box is there. Everyone's on mute. You can unmute yourself if you have any questions. And let's get started. So again, I'm Ivalee Sanzino with Radical Health, and I want to thank you all for taking time out of your day, especially your MLK Day, to join us here on this webinar. This is super important to me, and I think it's a important day. I'm going to put this on big screen here. This trip has been just really significant for the work that we're doing with Radical Health, and I think in today's time. So if we look at just this quote from MLK, right? First, we are challenged to rise above the narrow confines of our individualistic concerns to the broader concerns of all humanity. The individual or nation that feels that it can live in isolation has allowed itself to sleep through a revolution. Which brings us to what we're doing here. So this is our second delegation. This year is our Radical Health and Education. We are going to be heading out on March 30th and returning on April 8th. So we have about 10 days in the wonderful, beautiful country of Cuba. As we go through this webinar, we're going to cover a few key points. We'll introduce Radical Health and IFCO. We'll talk about our trip, the mission, the overview of it. We'll go through the logistics. We'll talk about what everyone, I think, is asking. How much will this cost you? What is your investment in this trip? And then we'll go through next steps, and we'll open it up for questions. So if you have any questions, we have a few people on the line. We have some past participants that joined us last year on the line. We have Gail Walker from IFCO, who will talk in a bit. And then, we'll answer all of your questions here. And if we don't get to them here, or if you're hearing this on a recording, you can always email them and we'll share them and hopefully get them answered to the best of our abilities. So for those of you who are new to Radical Health, who are we? So Radical Health, our official mission is that we return the work of healing to historically marginalized people through community co-creation and technology. And we do this by integrating services and lived experience to impact health. What that means in regular language is we really believe in a community approach to all things health. That the community, what we know today as health, traditionally is a paternalistic top-down approach, and we really believe that the community holds and has the power within it and the lived experience to be able to determine what it is that we receive. And to determine, policies, procedures, and the ways that we go about that, specifically through the act of community and sharing with one another and living with one another and caring all around. So we do what we do in a few key areas. One, we do community conversations where we bring together groups of people, specifically in historically marginalized communities here in the Bronx and in other areas around the city. We bring people together. We do needs assessments through this community dialogue. We then determine, collectively, what are the ways that we're going to address these disparities or the situations that we see, and we do that by building really just people getting to know one another and together determining what they want, and then inviting those in power, government, private entities, nonprofits to join in that. We also do trainings, and we do restorative health circles, so based on the restorative justice circle practice. We do that for health practitioners, teachers, or any social service provider as a way to humanize and see all of the pieces that impact a person's life in a very safe space. And then we have a technology component where we are building out a platform that allows to aggregate social services and make referrals as well as rate those services. All that we do falls around the idea of social determinants of health. And for those of you who aren't familiar, social determinants of health are conditions in which we're born, where we grow and age, and where we live and work, and have a great and super significant impact on our clinical health. So we're talking about childhood experiences, housing, education, income, employment, access to services. I think, you could add incarceration in there. You could add a bunch of other pieces on this slide. But what we really do is just look at, Radical Health's mission is to look at things holistically, to look at not just the clinical piece, but all of those other factors that impact our health. And so that's why we do these delegations. Last year, we looked at health and justice. So how does the justice system impact health? And this year is why we're doing education, knowing that the two are closely intertwined and really feed off of one another. And so now, when we're in Cuba, Radical Health organizes this delegation. We pull everyone together. We take you down there. We're with you the entire time. It'll actually be me. And we go through this whole process together as a group. A big piece of this trip, and we wouldn't be able to be down there if it weren't for our partner and our hosts here in the city, but also in Cuba, IFCO, the Interreligious Foundation for Community Organizing. We have Gail on the line, and so we're going to unmute Gail Walker, and she'll tell us a little bit about IFCO. Okay, Gail.
Okay, great. Thank you. I appreciate that thorough introduction and this opportunity to talk a little bit about IFCO and who we are. Part of what IFCO does as it relates to these delegations is really to work to help sponsor opportunities for people to go to Cuba and have that experience firsthand. And we've done that based on our long-term work with Cuba. But just real quickly, IFCO is an acronym for the Interreligious Foundation for Community Organization. And we're essentially a multi-issue ecumenical organization that's really been focused on community organizing as a way to address different levels of social injustice. And we've been doing this for 50 years. We just celebrated our 50th anniversary just last fall. And we have worked on a variety of levels, the local, national, and international level, to try to really raise people's consciousness about different issues impacting the disenfranchised or the people of color, people who have typically been sort of outside of circles of power, as a way to help people really have clarity about the way that these different issues intersect. We've done work on an international level in Africa, Central America, the Caribbean, and for the past 25 years have been working in solidarity with Cuba through a variety of different ways. We have organized an annual caravan where we take humanitarian aid to Cuba, where we are helping people to really understand the impact of the U.S. government's policy toward Cuba. The U.S. often refers to it as an embargo. We refer to it as a blockade, as does Cuba. The reason being that there are efforts to try to isolate Cuba by the U.S. government, and so that the caravans are a very instrumental act of civil disobedience to travel to Cuba, bring aid to Cuba, and embracing our right as people of faith and people of conscience to travel to Cuba and see that reality for ourselves. Secondly, we have been facilitating the involvement of U.S. students to attend medical school in Cuba under full scholarship at the Latin America School of Medicine, known by its Spanish acronym as ELAM. And that's one of the places that, among others, that we'll be have an opportunity to visit. There have been more than 36,000 graduates from a variety of different countries. From the U.S., where there have been 170 graduates since the program began in 2001, and these are folks, majority of whom are working in as physicians, residents in various medical institutions across the country. So it's a great way to sort of see the way that Cuba has provided this kind of incredible support for people of color, young people, people who wouldn't otherwise be able to attend medical school if it weren't for the scholarship that Cuba offers. And then lastly, we've been organizing delegations to Cuba to allow people, again, to go and see the island for themselves, to address the misinformation campaign that's been so prevalent about Cuba. As anybody who's lived in this country and has been exposed to any education, the educational system here would certainly understand that there's a lot of confusion about Cuba. People being able to go and see the reality for themselves is, we feel, the most effective way for people to make up their own minds about the reality there. We organize some of our own delegations. We've got one going down next month focused on agriculture, but we also work with different groups like Radical Health to also take on different themes. As was mentioned, we've dealt with health and justice in the past. Health and education is a theme this year. And I'm looking forward to just answering any questions and trying to help make this opportunity as best possible. As a group sponsoring this, we'll be using our resources, our years of work with Cuba to help identify programmatic areas that can make the program as dynamic and as exciting as possible. So I know that's a lot of information, but it's important to just kind of get a sense of who's IFCO, what is their role, how do they fit into this, what is sure to be a very exciting program. And again, I'll be happy to answer any questions whenever the time allows. And that's my spiel for the moment.
Thank you, Gail. So, Gail, we're going to put you back on mute, and then if you have any questions, use the chat or we'll unmute you then. So for those of you, I just want to make a note. I know that we have a lot of participants on the phone. If you are unaware or you're just on the phone, that's fine, but just know that there are slides that go along with what we're talking about. So there was a link in the email or however you registered where you can sign up and see these slides if you need the visual representation. Otherwise, as I said earlier, this is recorded and you can visit this afterwards and see what we're showing you. So I think thank you, Gail, for that explanation of IFCO, and I think it's really important, and when you're with us in Cuba, you'll see how important IFCO is, and also just the access that they're able to grant. They've been doing this work for a really long time, and I know that, I've had other friends that have gone to Cuba, and we went on this delegation last year, and you can clearly see if this is something that you wouldn't be able to get otherwise. This experience goes far deeper, wider, and really that's largely in part to IFCO and the work that they've been doing all these years, where doors open where they ordinarily wouldn't. And so, that brings us to why Cuba, why are we going on this trip, and what can we expect? There's a lot more than just the big cars and the cigars and rum. When I started Radical Health, everyone, I have a few friends, Gail included, and another, Melissa Barber, who talked a lot about the Cuban way, or the Cuban way of health. And for those of you who are on the call and familiar, you know exactly what I'm talking about. But if you haven't, there's this idea that the way that, and it's not even an idea, it's what they do in real life, that health is addressed in a really preventative, holistic way. So there's, local doctors and nurses that live in the community, and they're responsible for about like 1,000 people each, and they're accessible at all times. And you can just yell outside the window, "Doctora," and then she'll come down. And I didn't really know what that meant. I know, here in the U.S. there's this idea, there's the health that we know where you have to have insurance and you have to make an appointment, and there are places that you can walk in, but it'll take you 17 hours to get seen. And, I was just really blown away by that and really wanted to see it in person. And then as I started doing the research, right, this idea of, and even on our trip last year, we got to experience just some of this education and how they, first of all, education is completely free, and just this idea that really blew my mind away. And so we're looking at Cuba as really a way to examine an island that has very limited resources. We know, some of the history, the embargo, and what that means, but who's managed to have, I believe they're number 2 on the list of, I don't want to say the healthiest, they have the second longest life expectancy in the entire world, right? So their education, they've managed to basically eradicate illiteracy, and have done that, again, with very limited resources. So when I'm coming from, living in the South Bronx and seeing what we see, and being in America where we have all these resources, I have to think and say, what can we do, and how can we do things a little differently if Cuba can do this with very limited resources? On our trip last year, I just talked about the doctor. This is a map that they use. If you're looking at the webinar, they have a map, and where the doctor has, identified all of the local resources, specific houses that have special needs. But on our trip last year, one of our participants, Tracy Wells Huggins, who's a registered nurse, she said this. She said, "The Cuban health system is distinctly and defiantly in opposition with our own. Health of all the people is a priority, not revenue. Lives are a far more precious commodity in Cuba, and as a nurse, I would love to see the same sentiment be our country's standard." When we looked at the education system, we got to visit the literacy museum, but basically Cuba has gone from 70%, having slide issues, went from 70% illiteracy to 3% illiteracy in the span of 3 years. And, just again, thinking about that, really wanting to take a group down to explore that is really what we're aiming for this year. So what can we expect? This trip, this trip it's important to note that you are going to learn, and you're going to learn a lot. This is not a beach vacation, and I have to say that just with the warning that you will not spend 12 hours on the beach, but instead we'll be able to discuss principles, and you'll be, we'll visit, look at their different associations, visit the Literacy Museum. I want to educational. So you can expect 12-hour days, but a lot of that filled with fun and great times. But we'll be really looking at, having these conversations. We'll be visiting places and seeing things with new eyes. We'll be able to experience culture. And so this is a surprise for me, although I should have expected it. But, again, Cuba is really rich in its culture, and it's super integrated into the way of doing things. And so when we took this trip last year, I knew that we were going to have lectures and sit in circle and have conversations. But there's really something beautiful about the way that music and art and dancing, religion is all integrated into that. So you will be able to experience all of that during our time there. The other key thing to expect and to be aware of is that this is really a community trip. So before we head out, we'll have some webinars, we'll have some phone calls, but when we're there, when we're in Cuba as a group, as a delegation, we do practice circles. So we'll be doing, if you're familiar with the restorative justice circle practice, we'll be doing some of those same, we'll be hosting circles and creating space. We'll have small group breakouts. There'll be writing prompts. And then when we come back, you're still kind of integrated with the community as much as you want to be, but we'll have, a report back, and we'll have ways and spaces for us to grow. And I wish I'd put a photo here, but the group that went last year, we had about 20 participants, and we're all still just as connected. And it's really a beautiful time to meet some strangers, or maybe you might know someone, but to really build and grow in a community that you may have not thought of. So we're going to get now to the big dollars. What does this cost? Now, I want to clarify what we see here, and I think there's actually a typo. It is, so the program fee is $2,400. This includes your lodging, so where you're staying. This includes every meal, so breakfast, lunch, and dinner for the 10 days. This includes your translator. We'll have a translator with us the entire trip. We will have someone as our guide, so someone who actually is from Cuba or has experience, being there and leading these delegations, to kind of really facilitate a lot of the dialogue. On the days, we start our day with breakfast, and then we jump on a bus and we go to our activity, our scheduled activity. And even in those bus rides, there are questions about what to expect, or we're processing, or, as Americans, we're going to have a lot of questions, because this is something that, if you haven't experienced it, it really does bring up a lot of questions. And so our guide really serves as that point person there to answer those questions. This $2,400 also includes all of our excursions. So if we go to museums, wherever we go, that's all covered. So you really aren't coming out of pocket at all. The flight breakdown. We're going to be leaving out of Havana. So the flights, I checked this morning, the flights were about, I want to say, $325 from Miami to Havana. This will include the cost that we have here. It's an approximation, but that will include your flight to Havana and back, as well as your visa. And so we have a travel agent that facilitates that. Now, this cost is definitely approximate. You'll need to get yourself to Miami. I want to add a big caveat here, depending on the number of applicants and where we're coming from. If everyone that applies is coming from New York, we can leave from New York. That obviously will change the cost, but if we have people coming from different places, we're going to leave out of Miami. And so we'll make that a determination once the applications come in. But so basically, you're looking at about $3,400 for 10 days, all inclusive of everything. The piece that's not included, it's MLK Day, so you may or may not hear my child behind me. But so the pieces that aren't included, right? Gratuity for a bus driver. If you opt to purchase souvenirs or have, whatever it is, all of anything that happens outside of that, that isn't included, and that'll be on your own cost. But it's very, very limited, basically no out-of-pocket costs. What we do need, and so this is another important piece for the pricing and what can adjust pricing. We will need a $300 non-refundable deposit. So once you submit and you're accepted, then we charge deposit. But the other thing that's super important is we're leaving on a New York City Department of Education break. And depending on when we book flights, the flights obviously fluctuate. So right now I said they're about $350. When we book, or if we book later on, that price can increase. So it's really important that if you want to come on this trip, that we get you your application in and we get you booked as soon as possible so we can lock in that lower rate. I'm sure there are going to be a lot of questions around this, so I'd love to, when we open it up, feel free to ask away. But you can, plan for about $3,400 all inclusive. That number can be less, again, depending on the flights. So our next step, so what do we need to do? Obviously, we're going to submit this application. So there's a link on this PowerPoint, which we'll send out afterwards. If you go to our Radical Health page, radical-health/Cuba 2018, there's a link on there that you can apply. We are doing these applications, we're accepting them on a rolling basis. So basically, the sooner you apply, the sooner you will be accepted, and we will take your deposit. On that application, let's say you are unsure or you don't necessarily, whatever, there are questions, I would encourage you to fill out the application. There's a button that says we want to talk about alternate payment arrangements. Select that, but submit your application so that we can begin to process it. We have a limited number of spots for this delegation, and we want to make sure that you get your spot. Last year, we had people clamoring at the last minute, and there were a few people that weren't able to make it, which I felt bad about, but it's important to get that application in. Another thing, if you know that you're going and you're absolutely certain and you want to make it, the key, this is super important because we have a really tight deadline, is that you have to have a passport that has 6 months of validity after the final day of travel. So what that means is we're leaving and returning on April 8th. Your passport has to be valid for 6 months after that. So if your passport expires before October 8th of 2018, you will have to renew it. And so that means today, if you know that you want to go and you want to make it happen and your passport is expired, please submit for a passport renewal. And you might need to expedite that depending on how that goes. But we cannot book your travel without your passport. So again, last year we had some complications, and we just need to make sure that happens. Otherwise, you're going to pay significantly more for your flight. So final payments are due to us on February 28th. Again, if you have questions or you need to make, or shoot me an email. We obviously, this might be the second bullet, there's a little bit of a typo, but travel must be booked by March 9th. So we're leaving at the end of the month. We have to have that travel solidified the month before, and that's actually cutting it close. I'd like to have that done earlier. And then we're going to have 2 meetings prior to the trip. So if you apply, you're accepted. We'll have 2 meetings beforehand. We'll talk about what you need to know, what you need to pack, all the other nitty-gritty details. And we'll have those on the 9th and the 22nd. So this brings us to questions. I neglected to mention this earlier. We have Jessica, who will be helping us out and joining us on the trip to Cuba. So if you have questions, you can reach out to me or to Jessica, and we will answer any and all your questions. So what I'm going to do now, as we go through this, I'm going to unmute everyone's, I guess maybe that's a better way to do it. I'm going to unmute everyone's line, and if you have any questions, you can jump up and ask a question. Okay, so do we have any questions?
Just saying. Just send me some info and I'm listening to it.
Hello?
Hello?
Hi, my name is Kenya. How are you?
Hi, Kenya. I'm doing well. Thank you.
Okay. When it's time to book the flight, do you help us with the...
Stop.
I can't.
Oh, I'm sorry.
Oh, hello?
Yes,
okay.
go ahead.
I was saying, does Radical Health assist us with getting on the flight with the other members?
Yes. So the flights, we're going to book everyone's flight together. So we'll all be on the same flight. The exception to that And hopefully we don't have any exceptions, but the exception is if there's anyone who didn't book with us or waited too long or had a passport situation, we should all be on that same flight, but those people may need to have their travel booked separately and may need to do that separately. But we'll do it all through the travel agent. So everyone will go through the travel agent. We'll be together. We'll meet together. We'll meet before we take off, and we'll start the trip that way.
Okay, so that'll include, like, if we're coming from New York to Miami, and then from Miami to Havana, right?
So, okay, let's clarify this. That's a really great question, Kenya, and I'm really glad you asked that.
Okay.
So the travel agent will be booking from Miami to Havana, and we'll all be on the same flight there. You will be responsible for your own flight to Miami. Now, yes, here's the clarification. If you want help, the travel agent can help you in booking that flight. And the third, I guess, asterisk, if we're going to add that to that, is if the delegation is all coming from New York, then we will adjust the departure location. We'll all leave from New York straight to Havana.
Okay.
Does that help?
Yes. Okay, so to submit the deposit and the payment, we do this online, or do we go to Radical Health site, their location, and do it? How's that done?
Yeah, so the way that we do this is you can visit, let's go to the next slide. There's a link that I will put in the comment box now.
Okay.
Where that's the application link, so you can follow that link. Okay. Otherwise, if you go to the Radical Health site, there's a button that says submit your application, and it'll take you there as well. So you can go right on there and fill it out. A little bit about that form. We're asking for basic information. We're asking your passport information, emergency contact, and then there's a little bit of a narrative. So we just ask you for some quick questions, about the trip, why you want to go, so on and so forth. But it's pretty straightforward.
Okay.
I have a question, I released.
Hi, is that Elmo?
Yes, this is Elmo.
Hi, Elmo. Elmo, actually, sorry, I'm going to shout you out. Elmo was on our trip last year, and if you look at the guy all the way on the left, I don't know if you can see my mouse, that's him. Hi, Elmo. What's the question?
Hi. So, last year, is it possible to submit? One. I have a quick. Okay, this is my dilemma. So my dilemma is last year I was sponsored by my org, and this year I'm not going to be able to get sponsored by the org. I'm just taking vacation time through this. Is it possible to? Because I haven't checked, but how much is the deposit?
300.
Oh, 300.
Yes.
Okay. All right. I think that's all I had. I thought it was the whole thing. Yeah.
No. Yes. So just 300. And for payment, if you need a payment, you want to do it in chunks or work out a payment plan, we can do that. I just need an email and we can talk about that offline. Something else is on the form. If you submit your payment online, there is a fee, and I didn't put that in the pricing, but there are ways around that. So you can mail us a check, we can do a PayPal, we can do other things if you want to make payments, so you don't have to incur the processing fee, which I think is like 2.9%.
Okay. Thank you. Okay, let's talk later.
All right, wonderful.
This is Gail. Just to about that fee. That's only. It's not so much. It's really just to be clearer. If it's you pay by credit card.
Right.
So it's online, but it's specifically a credit card fee that they just pass on because the credit card companies charge that. But as you just mentioned rightfully, that the way to get around that, there are a variety of other ways to get around that. Anything but a personal check, but a cashier's check, and I think that should be indicated in the application. But that's what that fee is.
Yes. Perfect.
Hi, this is Medea. Thanks for holding this info session. I have a question. I have a couple of questions, actually. So first one, are children allowed? I'm asking because I homeschool my son, and I just think that it would be a great opportunity to share with him, and we definitely have a global perspective focus in our homeschool classroom. So are children allowed to come on the delegation?
Yes, so Medea, I will definitely like to chat with you. So this is, let's see how we do this. That's something that we would need to just make arrangements for. I don't know how old your child is.
He's 9
He's
years old.
Okay, so yeah, so we can make arrangements. I think you and I should chat offline on that. But if there is anyone else on here with children, I guess the question is, shoot me a note, and I want to talk with you because we can make some arrangements depending on what that is and how many kids we have.
Okay, great. And the second question is, do you have any resources on sponsorship opportunities for a trip like this, like how to just defray some of the costs? Are there organizations who give scholarships, who sponsor? Any resources you have, please shoot them my way.
Yes. So last year we did have a foundation sponsor seats for their for some of their grantees. I don't necessarily have any specifically, but this is something that if you have an organization or if you're a fund or a foundation, that we'd be happy to like develop an ask and petition for you, and so we can petition with you rather. So if there's an opportunity, we can also figure that out.
Okay, great. Yeah, because I do run a wellness business, so I don't know if there's any way I could collaborate with you on the trip or whatever. I'm just being really creative and having a conversation. So I'm looking forward to chatting with you about that.
Wonderful, Medea. Yeah, so we'll follow up then, offline and talk more about that.
Okay, thank you.
Great. Do we have any other questions on the line?
Okay, so where will we be lodging at exactly?
Oh, that's a great question. So last year, actually, someone might need to mute themselves. I don't know. Let's see if I got that one. Okay, I just muted someone. I'll unmute you in a second. So last year we stood, that's a really good question. We stood at the MLK Center in Havana, or outside of Havana. And it's a community center, and everything is in one space. This year we are still looking to stay at the MLK Center. There's an opportunity that we may, or a possibility that we may stay at another community center. But in any event, wherever we are, we'll stay together as a group. The accommodations are double accommodations. Oh, I should have mentioned this earlier. They're double accommodations where we go, and you'll have, we'll all be, we'll have room blocks, and all meals, everything else is included. Gail, I may let you jump in there if you have anything else to add that I might not have covered.
Yeah, if we wind up, so that's the Martin Luther King Center. It's the Ebenezer Baptist Church right next door is their center, and as Ivy just mentioned, it's the accommodations and food and meetings, and it's very much rooted in the community, and it's a great space. It is actually in Havana. It's just kind of an outlying community called Maria now, but. So they do have several different groups that are happening around that same time. So there's a possibility of another location, which is in central Havana. The housing there is slightly different. It is their more dorm setting. So there's several different rooms, and there's several more sort of beds in a larger room. So hopefully we can get some clarity on which of the two locations we can actually count on, and part of that will, be connected to how many people go and how soon we get the confirmation. And if I can just slide in that you mentioned the final payments due at the end of February, just how important that is, because we're actually a little tight with time. So the sooner we know, the sooner Ivy has that information and we can communicate about that, the better. And it'll help us determine exactly which of those two locations we'll be looking at using for the group.
Thank you.
And I'm sorry, if just to mention the other location that's I mean, it's part of they're both wonderful locations. One is they're both rooted in the community, but maybe perhaps the Martin Luther King Center a little more. And then the other is very within walking distance of those of you who might know the Malecon, the riverfront. Even it's a nice walk to Old Havana, but I mean there's some benefits to both locations. So we'll provide more information as we get closer and have an idea of just which one we'll be using.
Thank you, Gail. Okay. Any other questions from the group? Okay. So I'm going to take that as a no. As
Ivy,
you have time to... Oh, hi, Phil.
Hey, how are you? Well, the slide deck you made available, I jumped on kind of late.
Yes, so we're going to share the slide deck, and I'm glad you asked that. We're going to share the slide deck and the recording with everyone who registered, so everyone that's participating here. If you have any questions and you think about, other things, next steps, feel free to send me an email, or Jessica, so Jessica at Radical-Health as well. She will, we'll get back to you as soon as possible. The other thing is, and we want everyone to join us on this delegation because it's going to be phenomenal, but next year we're going again. So you can anticipate, a delegation every year. If this isn't, in your budget or you don't have the time, we'll be doing this again. And the theme for next year, I'm not going to announce it now. You'll have to tune in for another webinar. So we'll leave you in suspense. But we'll share all this information, and you can, take a look at it and review it and let us know if you have any other questions.
Thank you.
You're welcome. Okay, so I want to thank you all for joining, for taking time out of your day. For those of you who have the day off, I hope you get to enjoy it. Thank you, MLK, for all you did and for giving us a day off. And so, again, any questions, feel free to reach out anytime. And we hope to see you all in Cuba. I promise it'll be an experience to remember and really life-changing. So thank you all, and take care.
Thank you. Bye.
Bye-bye.
Thank you. Interesting.